The release of information from the East Shore Health Department calling the situation an outbreak caught some local officials off guard. They say they have known of the incident for over a week now and have taken actions to limit the spread.
Putting out this vague information has created more anxiety and problems in our community.
Representative Vincent Candelora was critical of the East Shore Health Department's release of an investigation into a COVID-19 outbreak in North Branford. The local health department saying the COVID-19 variant was linked to a large family gathering in town.
They've created, fear-mongering. They've pitted people against each other. Accurate, clear information needs to be put out.
Candelora says the town has been aware of the incident for over a week. 2 people at the family gathering of about a dozen had ties to North Branford High School. One of them a student on the hockey team. School officials say contact tracing yielded no additional positive test results.
What we continue to see is that there's low transmission in school and among athletes.
Per CIAC rules and regulations, the hockey team had to quarantine for 14 days.
They're due to come back at the end of this week, and then, the positive student has a series of steps that he'll have to follow before being able to join the team again.
There are at least 16 known cases of the new, more contagious variant in the state of Connecticut. Superintendent Schoonmaker believes it was only a matter of time before the first instance appeared in town. He says the school system has a well-developed plan in place to handle it.
People need to remain calm and have faith and trust in the fact that the well-being of our students and staff is our highest priority for all educators in the country right now.
North Branford High School has remained open for 5-day-a-week in-person learning for the entire school year. They say being able to do so is a testament to their students for taking precautions seriously. In North Branford, Dave Puglisi, Fox 61 News.